this was my identity.
Nobody talks about how freaking hard it is to be a dentist. What most people talk about is how this affects the patient. What nobody talks about is how this affects us. Dentistry is ready for this. Now is really the time.
Welcome to Wellness and Dentistry. I'm one of your co-hosts, Dr. Martin Mendelson. I'm a disabled dentist, coach, speaker, thought leader, and author. And I'm joined by my good friend and co-host, Dr. Kyle Stanley, who's a dentist, tech entrepreneur, speaker, and researcher. And together, we've helped thousands of dental professionals pursue wellness and dentistry. Now, if you're unfamiliar with us, we invite you to go to our website, Wellness and Dentistry, and check out our respective links, websites, as well as course offerings. And speaking of which, if you like what you're hearing on this podcast, you have the opportunity to spend 2 full days with us this coming August 1st and 2nd in Irvine, California, in beautiful Southern California, where we're going to jump into our course called Light Side Live that's worth 12 CE credits that focuses in person on all things wellness and dentistry. But today, we're going to be talking about a fun topic, which we've titled When Passion Fades, Reigniting Purpose in Dentistry. So, Kyle, first of all, hello to you.
Hello.
So,
Yeah,
what do you think about this topic?
it's such an interesting topic because dentists are passionate about dentistry.
Yeah.
I mean, there's even memes about it, and I can't remember if you sent it to me or I sent it to you or someone, but there
Yeah.
was this recent one where it's people at a dinner table and it said the first person to talk about dentistry pays for the meal, and it's just
Yeah.
like
Yeah.
everybody eating quietly.
Yeah.
I mean, that's how we are. You get dentists together and we're like, are you using Emax and what thickness and what bonding agent you're using? And have you tried this new implant system? And
Mhm.
what are you going to do are you doing chairside milling? Are you doing 3D printing? Like, we love this stuff.
Yeah.
However, we also hear that the passion fades over time.
Hmm.
And it's very easy for the passion to fade when you're in burnout.
Yeah.
And I was in this weird stage when I was in burnout where I was still so passionate about it, but so burnt out. Like
Hmm.
for me, my passion didn't fade for it. I think I almost had too much passion.
Hmm. Hmm. Yeah. Well, it's almost as if your passion was driving the exhaustion, and the more exhausted you got, the more you jumped in because that's kind of what that was your security blanket, so to speak. And then it became this revolving, circle of where you ended up. Just one side kept forcing the other, so to speak.
Yeah, on our last podcast, we talked about the definition of burnout.
Hmm.
And one of the 3 points in burnout is cynicism,
Hmm.
feeling cynical about your job. And I think that's kind of what happens when people lose the passion is, or let's say quote unquote lose the passion. I think what happens is they become cynical about their job, doing, a DO on a second molar on a patient that won't open, or oh my gosh, doing this difficult procedure on this difficult patient. Like they start getting cynical about it, and that pulls away their passion for it.
Yeah. Well, not only passion, but compassion. So, we did a Light Side Live today, and we were talking about this one post that was on Dental Nachos about patients' anxieties. And there were some, I'll say choice comments on there, but a dentist took the thread, she took out the names, and she made a whole TikTok video about it relative to what are you all doing? This is your job to deal with anxious patients. Like, if you can't handle this, get another job. And she wasn't incorrect. And so now I'm looking at this from a burnout perspective because, what are you getting burned out over? Because with all the team challenges these days and hiring challenges these days, are we getting burned out from that? And then therefore we're seeing this cynicism all over the place relative to
Mm.
team, right? Because
That's an interesting point you bring up.
yeah.
And I kind of relate it back to my experience and the experience
Mhm.
that I've seen with any other people. And I'm just thinking of this kind of out loud, but what I think probably happens with people losing the passion is they don't lose the passion for the clinical dentistry.
Right.
they lose the passion for dealing with people.
Yeah.
And I've heard many dentists say, I'd love to do dentistry if it was just on like a model,
Yeah.
right? If it was on in the sim lab,
Hmm.
right?
Hmm.
Where the patient doesn't have to pay anything, or they always pay, let's say,
Yeah.
and they're never late. I don't have to deal with my assistant coming in late or being snarky about something that
Hmm.
he or she says. That's the stuff that burns us out and that makes us lose the passion for clinical dentistry. I don't know a lot of dentists that are not passionate about the clinical work.
Right.
I think we all
Exactly.
love that.
Yeah.
Even you and I who don't practice anymore, I think we still like
Hmm.
talking about the clinical work,
Totally.
right?
Totally.
We still like the idea of taking a big blown up tooth with caries and
Hmm.
cleaning it out and circumscribing the caries and getting it
Yep.
nice and clean and bonding it. And, that stuff's, there's something very rewarding about that. So, how do we reignite purpose into dentistry?
Yeah. I think part of it is really understanding, or as you would say, realize where your stressors are coming from. And so, as a
That's
coach,
stage two of my framework.
yeah, I
Hmm.
mean, as a coach, if you and I were talking one on one and you said, I really hate dentistry. I just can't take it anymore. I'm really burned out.
Yeah.
I would look at you and I would say, you know what? That makes a lot of sense. You work really hard. You've trained all these years, and there's all these other things that are drawing your attention. So, makes sense that you're a little bit frustrated. Now, when you say dentistry, Kyle, what about dentistry do you like or dislike? Excuse me. And so, teasing out what it is you don't like is critically important. I've even had this discussion with dentists actually about the clinical side relative to procedure types, where in this one particular case that I'm thinking of, this individual felt the need to perform endodontic procedures and hated them. And so my question was then was, okay, so now, and we did a lot of work to get there, so I don't want to discount that. But when we finally got there, I asked the question to understand what was the story that was in their head. And I said, so why are you still doing that? And the person said, because I feel like I have to from a production perspective. But then when we actually then went and analyzed the numbers, it would take them so darn long to do a molar endo that it was actually losing money, not making money. So it's really important to understand what it is that's driving your stress. And for some people, that's easier than others, but it's a hugely important first step.
Yeah, it's funny that you said because I was thinking about my own experience with that. I got out of school and I really liked doing everything. I
Hmm.
did this weird kind of perio-pros residency in Brazil, so I was doing perio and pros stuff, but I was also doing like biomimetic dentistry,
Hmm.
doing fillings and inlays and onlays and crowns and dentures and all in fours, and I was kind of doing everything.
Hmm.
And I remember a few years out, my partners came to me and said, Kyle, we think you should really focus on doing surgeries and doing implant stuff. Like you're really great at that, and
Hmm.
we can handle the rest of the stuff. And at first I was kind of annoyed because I felt like,
Hmm.
I have these other skills, but there were things that I didn't like. So for
Yeah.
example, I hate packing cord. I hate packing cord, especially when you pack the cord and it's bloody,
Yep.
or you pack the cord and then it comes out and you got to redo it. Like I hated that. And I
Hmm.
remember this conversation where my partner, Amanda Shaw, had came to me and he said, Kyle, I know you hate doing crowns. And I was like, you're right. I
Yeah.
hate doing crowns.
Yeah.
He's like, imagine if you didn't have to do a crown again. And I was like, that kind of sounds awesome because I love doing surgery. I
Hmm.
love doing implants. Like I love that stuff.
Hmm.
Crowns, I don't like doing them.
Hmm.
And also, too, I had more complications with crowns than he did.
Yeah. Yeah.
I took longer.
Hmm.
Ortho's a great example of this too. I am an advisor for a company called Two Front, a tech company. You were on the podcast that I,
Hmm.
I do with Ingrid, and that's one of the things that they do is, well, they outsource some of this ortho stuff in your own practice. Because what I did was like, okay, I'm gonna be doing these veneers. It's gonna be like 6 months of ortho. Like I can just do this myself, right? So I did
Mhm.
aligners, but then I realized I'm not that good at it.
Yep.
And it wasn't worth the money. I mean, when I
Nope.
looked back at the per hour fee, I was losing money to do my
Yep.
own ortho.
Yep.
It honestly made sense. Now, of course, there's people that are GPs that do incredible ortho. I mean,
Yeah.
sometimes maybe even better than an orthodontist. And there's orthodontists that do other stuff too, right? But you have to look at yourself. You have to understand, are you making money on it? Are you enjoying it? Now,
Hmm.
even if you're not making money, but you're enjoying it, maybe you still want to do it,
Yeah.
right?
Well, yeah.
Unless it's going to cause you
Yeah.
strife, unless you're going to complain that you're not making any money, and
Yeah.
that is going to impact your burnout.
Well, and I think true, like, you said earlier, and it's true, almost every conversation you hear about burnout, it's almost never the clinical dentistry, right? And so when you think about what it is that you're choosing to take on from a leadership or management or HR perspective, um, A, do you enjoy it and is it worth your time? So, you know this because I'm using now, as of tomorrow, your bookkeeper that you've been using for a long time because I sat back and I realized this takes me between keeping up with my books and doing taxes every year. It's literally 2.5 weeks of full-time work because I monitored it. And I'm like, I can make a heck of a lot of money in 2.5 weeks. And
Right.
so is it worth it for me to do this stuff financially? And oh, by the way, I hate it. And so the answer was no. And so now I'm going to invest relative to my fees, a very small amount of money to have something done that I don't enjoy, that was driving stress, that was taking up time. And there's all kinds of examples. In fact, in my online course, I know you know this, in my lesson two, I challenge people to actually conduct a time and task audit of their own lives. And I give people tools to do this to better understand actually how you're spending your time. Are you in a time deficit or time surplus? How much are you spending on this kind of stuff? And I talk not just about dentistry and clinical stuff. I also talk about stuff at home. Like I think I give an example of making dinner versus a meal prep service, cleaning your house versus a cleaning service. And yeah, cleaning services cost money, but if you're spending, let's say, every weekend for 3 hours cleaning your house, what's that 3 hours or 12 hours a month, a whole day worth to you, right? So
Yep.
this all is related to burnout, effort, stress, time burden. It's all related and interrelated.
Yeah. Yeah. And it's kind of going back to what we talked about at the beginning, which I think is many dental professionals don't lose passion for the clinical work.
Yeah.
They get burnt out by the areas where they don't have the skills.
Hmm.
So we'll talk about this in any of our with dentists that we work with. You'll say what's the hardest part of what you're doing now? What frustrates you the most? And they'll say, my team.
Yep.
Or they'll say, patients are just really rude, right?
Hmm.
They're not saying my implants are all losing bone or my dentures break
Yeah.
after a day. Like most of the time they don't say that. And so it's these unknown unknowns for them. It's these blind spots of soft skills
Yeah.
that will actually reignite your purpose in dentistry.
Hmm.
Because let's think of let's think of the practice of dentistry as a pie chart.
Hmm.
And if you went through and identified all the different parts that cause you stress, I mean, it may be all these other things, and only 20% of the pie chart is clinical dentistry, and you may not
Hmm.
have stress with that.
Yeah.
You
Yeah.
may have a complication here or there that causes you stress, or the lab case is late or something like that.
Hmm.
But it's like, why are you putting all your time, money, and effort into that 20% that doesn't even cause you stress when the 80% is the stuff that causes you stress? Let's learn how to mitigate that. And then think of how you could enjoy your practice if you could control or have some more knowledge about that other
Mhm.
80%.
Yeah. And you know what I just thought of that I didn't even think when we recorded yesterday is this. You talked about the primary cause of burnout is chronic stress, right? And it's the team stuff, the HR stuff, the management stuff that's causing the chronic stress. The patient clinical stress, that's acute stress.
It's acute stress.
That's transient. It's, here and there. It's not, for most, particularly if you're more than, let's say, a year or two out of school,
Yeah.
you're not worrying about going in every day and performing. You're worried about all that other stuff. And so it's not that we don't have clinical stress, it's that within the world of burnout, if we align with not only the definitions, but the etiology of chronic stress, well, patient care isn't chronic, it's acute.
I think of, the second half of this topic, it's when passion fades,
Hmm.
reigniting your purpose in dentistry. And I believe if we're going to talk about purpose, most of our purpose should be outside of dentistry.
Yeah, yeah,
Dentistry is our job. You can be passionate about it, you can love what it is, but it's not who you are.
yeah,
And I think that was one of the problems that I had was I thought I should get my purpose from dentistry. And then if you don't, maybe something's wrong with you.
yeah,
Because it sounds nice, right? Well, I help people get out of pain. I give them their confidence back. I allow them to chew better. I make them healthier. That is all just and that is all virtuous. But I hope that your work doesn't define who you are. It
hmm,
should really be your relationships that define who you are. And hopefully those relationships are outside of your profession.
yeah,
So I think we need to think about purpose in life as mostly being outside of our profession.
yeah,
Now,
yeah,
maybe part of your purpose can be inside of your profession, but
yeah.
not your entire self-worth.
Yeah, I would agree with that. I mean, it's a little hard to get away from falling into the majority trap of making dentistry only because of the number of hours you
We
spend at it,
spend more
right?
time doing that than anything else.
So it's easier to do that. But what if your purpose was, you know, being a leader in my community in all ways? And so that could be a leader in oral health, that could be a leader from a business perspective, that could be a leader from a mentorship perspective. You see what I mean? So it's like even within the confines of clinical dentistry, there's different ways we could actually spin it, which are not inconsequential. Like sometimes life has a lot of nuances to it, right? And
Many
so,
times.
because it's like the age-old thing that everybody's heard ad nauseum, on your deathbed, what are you going to be regretting? It's not that you spend another hour in the office. Everybody knows that's true, but they don't give the respect it deserves. They acknowledge it. It's like that meme, and I know I've mentioned this before, where you have these two windows and it says, people who want change, and there's a whole line. And then the other one says people who want to change, and there's like one person in the line.
Yeah.
It's like, it may take you some work, but it's important. I was just what 3 4 hours ago. I was on a call with one of my coaching clients who's been through a lot in their practice, and now they've kind of come out the other side, have a really good team, things are pretty stable, etc. And so most of our conversation today was great. So how do you want your life to look like in the next couple months? What would you like to do? You're working a little less. How would you like that time off to look? And it can be so hard for us when we've been stuck in, workaholism for so long, which let's be respectful. There are times in our lives where that is needed, important, and warranted.
Cycles
It cycles. It just can't be the
forever.
totality, right? It can't be
Yes.
forever. But let's respect cycles. I mean, look, I've had a lot of cycles in my own business in recent years where I've been working a lot. And, even last year I didn't take a lot of time off because I was building something. And so that's fine, but I made the change this year and I
You had
and
an
there's
end date on that.
yeah, I had an end date, right? So that's hugely important.
Another thing I believe we need to think about is thinking your passion has faded, wanting to reignite purpose in dentistry but also looking at what you're doing outside of the practice.
Mm-hmm.
Because it's very difficult to show up in do dentistry because this job is hard.
Yeah.
To do this job if you're not showing up in the right position. So that means being well slept, having eaten well, having
Mm-hmm.
exercise, having your mind in the right place, having your outside relationships be in a good position so that
Mm-hmm.
you're not thinking about them when you're prepping a crown. I believe that if you do a lot of these things outside of your practice, it makes managing your practice much easier. So
Mm-hmm.
an example of that, let's say you're not prioritizing sleep.
Mm-hmm.
So now when you show up, you're tired. Not only that, you're going to be extremely reactive. And this is
Yes.
not my judgment. This is research and science that the less you sleep, the more reactive you are. You have a harder time controlling your emotions.
Yep.
So then you snap at your front office, you snap at your hygienist, you snap at your business partner, you snap at a patient. How does that impact the relationships? That makes you more stressed. And then you say, gosh, the dentistry is, I just lost all my passion for this.
Mm-hmm.
Some of that may be controllable.
Yeah.
And it's
Yeah.
the same thing. It's like, as I'm thinking about it in my head, I'm thinking about it as three different sectors. So it's like
Mm-hmm.
you have outside of dentistry, what we could do.
Mm-hmm.
You have clinical work, which is
Mm-hmm.
another sector.
Mm-hmm.
And then you have non-clinical work in your practice. Okay.
Okay.
And I think we try to lump the clinical work and the non-clinical work
Yeah.
together.
Yeah.
So we'll say like, oh, I've lost my passion and
Yeah.
dentistry is just too hard. Is it the dentistry or is it the non-clinical work? And I would argue most of the time
Mhm.
it's the non-clinical work
Yeah.
that people are having a problem with,
Yeah.
but that's not what they're putting effort into.
Correct. And I like where you went. Let me take it a step further in a way. So what if you took three pieces of paper? You put personal, clinical, and non-clinical at the top of each of those three pieces of paper. Down the center of each of those three pieces of paper, you draw a line. And then on each of those pieces of paper, on the left side of the line, it says good stuff. And on the right side of the line, it says bad stuff or stuff I like, stuff I don't like. You get the idea. And then you just start with the stuff you like about each of those categories. And then you go to stuff you don't like. Because I want us to start with the stuff that we actually like first, to really understand, as you said, which list is longer and the good or the bad, what patterns do we see, and then to look at each list and say, okay, if I could focus on these three good things, and if I could reduce or eliminate these three bad things, how do I think my life would look? Right. And
I
so
think
that,
I think it's a great
yeah.
exercise, and we should actually do that at some point. Maybe
Yeah.
in our life courses, we should do
Yeah.
that because I think it'll give people a visual too of the importance. I would guess
Hmm.
that most people's non-clinical sheets
Yeah.
will be much longer,
Yeah. Yeah.
and it will many times be things that they can control.
Yeah.
The clinical work, some of it may be uncontrollable.
Hmm.
Thinking of my concept of triangle of blame here, right?
Yeah.
That it may be biology, it may be physics, it may be things that you can't control. It's still annoying and it's still frustrating, but if you can't control it, the only thing you can do in that process
Yeah.
is communicate better to the people
Yeah.
involved.
Yeah.
So communicate better to the patient, communicate better to the lab, communicate better to yourself if you can't control it, right? But then you may look and there's all these team challenges. There's all these personal challenges. And I would argue that a lot of those, you just need the skills for those.
Hmm. Hmm. So the way to look at these kind of things when you're running into a problem or an obstacle, or even in certain cases, a limiting belief, you ask yourself three questions. Is this a skill problem, a resource problem, or a mindset problem?
Oh, yeah, I love that. You mentioned that, I think, on our last podcast, maybe.
Yeah, skill. So shout out to Jen Romanowitz, one of my mentor friends from the Eggheads, which is a non-dental coaching group, mastermind group.
So you said skills, mindset,
Skills, resources,
or
or
resources.
mindset.
And then, yeah, and then you cross-reference that with personal. And for those listening, I'm writing this down as we're doing it.
Yeah,
Personal, clinical,
and non-clinical.
and non-clinical. Yeah.
And so the way you would use these three questions is once you go back and you look at the stuff that you don't like, you ask yourself the first question, which you were talking about, which is really important, is can I control this or not? If the answer is yes, then of course the next question is, okay, great. What am I going to do about it?
Do it. Yeah.
If the answer is no, then it's like, okay, wait a minute. What am I not being able to control? Is this a skills issue, a resource issue, or a mindset issue? Like talk about that example I talked about earlier about molar endo. That wasn't a resource issue. That was a mindset that I thought I had to do it for production. And then when we evaluated the efficiency, he was actually losing money at it. That was a mindset.
I think this is really powerful what we're talking about.
Mhm.
I'm visualizing this and
Yeah,
I think it's really powerful. And the mindset, do you think that is the easiest or the most difficult to change?
most difficult because typically it's your thought patterns
It's
and
learned.
it's a learned thing. And, as we like to say in coaching circles, it served you to get you to where you are today,
Mm.
but now it isn't. And so it's become habitual to question authority, to question people's motivations, etc. For whatever reason, it got you where you are today. But now, you're questioning everything and everybody, and now all of a sudden it's not serving you because, it's resulting in results that you don't like.
It's funny that I think with me and with people that you and I have worked with, I've seen that the mindset ones are the biggest change though.
Oh yeah.
They make the biggest change in their life, which is funny
Okay.
because like, in dentistry we think, oh, the biggest change is going to be when I learn how to place my own implants. The biggest change in my practice when I do chairside milling. Like they think it's going to be
Yeah.
that. Sometimes you just say the biggest change is when I finally say I'm putting myself first, or I'm going to learn how to be a better leader, or I'm going to realize that my profession doesn't define me. And that is when you see people that truly change, their career grows, their relationships get better. I mean, their life they start thriving in life
Yeah.
simply because of a mindset change. And I used
Yeah.
to think so much of this was bullshit. Like this mindset stuff, I
Yeah.
used to think was such bullshit. But like, there's good research on it.
Mhm. Yeah, I mean, a lot of people do, especially dentists, because we're trained in the sciences and we're asked to come to a diagnosis based on fact, and so this kind of flies in the face of all that in a lot of
Yeah.
ways, right? I mean, even look at treatment planning. There are skills related to treatment planning, but I lived at Spear for many, many, many years, and I started to observe that it was a confidence thing more than anything else. And talk about mindset. My patients aren't interested in this. It's like, really? Who made up that rule? Right. And so, if you really were to break down what was getting in these doctors' way of presenting treatment plans differently, a lot of it was mindset. And some were assumptions made on previous interactions that may or may not be true for current realities. And it was all thoughts that were getting in their way.
Yeah. God, it's so crazy. It's funny how some of this stuff, as we're talking about it, we make these
Yeah.
realizations,
Yeah.
like it gets deeper and deeper
Yeah.
and deeper.
Hmm.
So we talked about when the passion fades, reigniting your purpose in dentistry. We talked about how part of that is having the self-awareness
Hmm.
to
Hmm.
realize that maybe it's not coming from clinical work. Now, the good thing is that if it's coming from clinical work, it's fairly easy to fix.
Yeah. Yeah.
But that's what most of us spend all of our time and money on.
Hmm.
We talked
Hmm.
about finding your passion outside of dentistry, realizing that your purpose in life is generally not your job.
Right. And we didn't spend a whole lot of time on that, but the paper exercise we talked about will help you do that. It's like, okay, so when I'm on my time, what are the things I really enjoy doing? Well, I love, hanging out with my spouse. I love going to the park. I love cooking. I don't like cleaning the house. I don't like doing the bills. You get the idea? So, and on the personal side too, one of the questions you can ask is, uh, what are things I enjoy doing that I'm not currently doing?
Right.
Well, I used to love playing the piano. Well, why aren't you doing that now?
Hmm.
Right? That kind of thing.
Yeah. This goes back to your time audit too.
Yeah.
I think with in maybe all three sections of these, which is am I doing so am I doing something that I don't like? And if
Yeah.
I am, is it something that I should not do and pay someone else to do?
Yeah.
And is that
Yeah.
worth it? And many times specialty work can be like that.
Hmm.
I know GPs that are incredible at doing specialty work.
Hmm.
They're doing implants or they're doing oral surgery or they're doing ortho or they treat children, they're doing pedo, and they're fantastic at it. And I
Yeah.
also know some that aren't so good at it. And I know some that are like, I never want to treat kids or I
Hmm.
have no interest in
Yeah.
doing ortho. And so it's up to how much you enjoy it, how it serves you in your practice. But I've mentioned it on here before. I have friends that have very successful practices and do zero specialty work.
Oh, yeah.
Like they do crowns and fillings and bridges,
Yeah. 100%. 100%.
and they have extremely successful
And I
practices.
also guarantee you they have extremely honed in and refined scheduling templates.
Yes.
Guaranteed.
I mean, that's one of the great things when you think of a specialty practice. And I think that's how many of us should think about ourselves if we're talking about general dentists. Think about yourself as a specialist
Hmm.
in restorative dentistry.
Yeah. Yeah.
Like if you only do a few things,
Hmm.
that can be a great thing
Yeah.
because you can have systems, protocols, scheduling
Yep.
templates, scripts, follow-up automations. I
Hmm.
mean, all of that can be automated so that patients are getting the same experience and you can refine that experience down to be so good.
Yep.
And selfishly, that will mean less burnout and stress for you and your team.
Totally. Totally. Yeah.
So, what final thoughts do you have on this topic of when the passion fades, reigniting your purpose in dentistry?
I think it really does go back to realizing what the problem is. And I think my final thought is not only do we need to realize where we believe our stressors are coming from, we also need to realize where our joy comes from too. Because if you're going to reduce the stuff that's causing you stressors in a perfect world, what are you filling that time with? So I think both sides of that coin are equally important.
Yeah, I think I would agree with you on this. For me, this entire topic of today is having the realization to point to where the problem is coming from.
Hmm. Yeah.
And I'll tell you, that is a skill in itself.
Yeah.
I
Absolutely.
hate to tell you that because at the beginning, I didn't really know where my stressors were coming from, but that became part of my process. That was why I
Yeah.
included it in my Ripple framework.
Yeah.
First step is realizing
Yeah.
there's a problem, understanding the problem. The second step is identifying the triggers.
Yeah.
So that's kind of what we talked about today in that little exercise that we came up with as we were talking
Hmm.
about this, is identifying it. I think so much of this is asking yourself, my favorite thing from you, which is
Hmm.
how true is that, right?
Yeah.
I hate dentistry. How true is that? Is it
Hmm.
dentistry or is it dealing with team members?
Yeah.
Or is it
Exactly.
the fact that, it's the work-life balance, right? That's because that's not dentistry.
Yeah.
That's time management or
Yeah.
that's setting boundaries.
Yeah.
So being honest with ourselves, understanding the problem well so that you can say, okay, this is the problem I have. These are the areas and the specific things that are causing me stress, chronic stress. How can I change them?
Absolutely. And I have to say too, even from my own personal experience, um, learning is important to me, health is important to me. And I've noticed, particularly in the last 6 to 7 months, by the time this comes out, having kind of reignited my purpose in my body's health. If I'm sitting down at like 8 o'clock at night to watch television, knowing that I put in a full work day, I've worked out, I've eaten healthily, and I practice my Spanish on Duolingo, which is something I'm enjoying, all of a sudden the ability to just quote unquote relax is so much easier.
Hmm.
It's when you're not doing these things that you sit down and you think, oh, I should be doing X, Y, or Z. Now,
Yeah.
some of us, particularly parents, etc., the responsibilities never stop. So
Hmm.
very much respect that reality. While at the same time, you are going to be driving additional stress by not understanding what's causing stress in things that you perhaps could eliminate or reduce, and what's creating joy that you may not be doing or could increase. So,
Yeah. Well, we hope you guys enjoyed this episode. If you want to spend 2 days with us, make sure to go to wellnessanddentistry.com, go to links and click on Lightside Live. You can see our 2-day transformational CE course. It's 12 CE credits. We do it in Southern California. The next one is on August 1st and 2nd. So we'd love to see you there. And also, if you enjoyed this podcast and you thought, gosh, I really learned a lot, and you've got a colleague or a friend or a spouse or someone else in dentistry, we would love it if you would send it to them. I know that when I have close friends or colleagues that send me stuff, it goes to the top of my list. And so that's, we don't ask much from you. We try to give as much as we can in this podcast, but that's one thing that we would ask is just help us share this. That supports our podcast and allows us to put even more effort into it. So we hope to see you guys online, in person, or at our next podcast. And we'll see you on the next episode of Wellness and Dentistry.
take care.